Welcome back, viewers. Hello, Fabrienne. In this video, we'd like to discuss a specific heart medication called ivabradine and its possible use for the treatment of Fabry pain. Recently, a German friend of the channel tried this same drug for Fabry-related tachycardia and she reported a decrease in pain. Since, we managed to find a second patient who reported the same effects. As it turns out, there is an explanation for this. But first, let's present some of the better known facts regarding ivabradine, and then we'll talk about its possible effect on Fabry pain. Ivabradine is an oral drug that is mainly prescribed to treat heart-related chest pain and heart failure. Its primary mode of action is reducing the heart rate. Usually, it's only prescribed if other drugs like beta blockers and calcium channel blockers are not well tolerated. Although it aims to reduce the heart rate, ivabradine isn't approved for the treatment of tachycardia. Still, it is reported to be effective for the treatment of conditions like inappropriate sinus tachycardia or postural orthostatic tachycardia syndrome, although this is off-label use. Now, what does this have to do with pain? Ivabradine works by inhibiting the so-called HCN4 channels, which are involved in generating the heart frequency signal. As the name suggests, there are other very similar channels called HCN1, HCN2 and HCN3. Ivabradine doesn't just inhibit the HCN4 channels, but all HCN channels. Now, what do the other HCN channels do? Especially the HCN1 and HCN2 channels play a role in signal transmission in the sensory nerves of the dorsal root ganglia. As we described in video 1, there is an association between Fabry pain and increased dorsal root ganglia volume. Additionally, it was demonstrated that the HCN channels in the dorsal root ganglia of older Fabry mice behave abnormally. Despite the dorsal root ganglia being part of the peripheral nervous system, they are not protected by the blood-nerve barrier, which means that ivabradine should effectively reach the dorsal root ganglia. An analgesic effect of ivabradine was demonstrated in different inflammatory and neuropathic pain models in mice. As for actual people, published results show an effectiveness for the treatment of diabetic neuropathic pain. A possible role of HCN channels in Fabry pain might explain the effect of ivabradine reported by the two patients we mentioned earlier. At the moment, Fabry pain is often treated using GABA analogues like gabapentin and pregabalin. The patients Fabrienne is in contact with report that these treatment options only offer a minor alleviation of pain symptoms at best. The same goes for other medications like amitriptyline. This means that patients need better treatment of Fabry pain. Ivabradine might not be an option for patients with bradycardia, but it might have two positive effects for Fabry patients who suffer not only from pain, but also from tachycardia. Therefore, we can imagine that other patients might benefit from it. So, with this video, we would like to ask you, viewers, the following question. Are there other Fabry patients using ivabradine as a combined heart and pain therapy? If so, please leave a comment or write Fabrienne an email. If we receive any responses, we'll summarize them in another video. We hope to see you there. Until then, feel free to write and have a wonderful day.